us okay on the, all right, cool. Move it down here so it's out of the way of the shot. That's fine. It won't be in my way. Call the meeting to order. Call the roll.
Trustee Healy? Here. Trustee Katsinas? Here. Trustee Milani?
Here.
Trustee Compass? Here. Trustee Reardon? Here. Trustee Radiszewski?
Here.
Mayor Peacock.
Here.
Please rise for the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you all for coming tonight. This is an important topic, and so we felt it was important to have this meeting as soon as possible, and which is what we're doing. And I know that we're all going to go to the taste after this, or most of us are. Some of us are dressed for it, actually, like me, because it starts at 5 o'clock. So with that, turn it back over to the clerk.
Resolution again encouraging the Illinois General Assembly to convene to address COVID-19.
Mr. Chairman,
Trustee Milani.
I move to adopt a resolution entitled Resolution, again, encouraging the Illinois General Assembly to convene to address COVID-19.
Second.
So before we get going with debate and comments on the motion, can you please put up the slides? 1 minute. Okay. So I have a brief presentation I'm going to get that give that has a lot of data and information before the board members comment. Was this was a curveball?
I could never wear something like that to a foot fence.
Hey. Well, sorry for all that awkward silence. We're here tonight because of the actions taken by the governor with the mask mandate for schools and for children, essentially. Obviously, adults that are going to schools as well. But I'm going to, before the board comments on our resolution, I am going to walk us through some slides. Get the slideshow going here. So this data is current. So as we look at this, we're hearing right now that we have, leave that right where it's at. What we're hearing right now is that we have a surge, and that it's the other thing that we've been hearing for over a month. It's the Delta variant and it's kids that are causing the surge. That's what we've been hearing over and over and over and over and over again. It's been the mantra from the governor's office, it's been a mantra from the press, it's been a mantra nationally. So this is the cases since the beginning of April of last year. You'll see that you see a spike on the left-hand side. That was our first wave. Now, it's so low because we had no testing back then, if you recall. So the cases are, you know, as anyone would probably tell you, the cases were higher than the one at the end of the year when we had a lot of testing, because we had no testing. So you had a spike, you had another spike, then we actually had a third surge in April, May. You see that little hump? And now we are actually in the middle of a fourth surge. You see how much lower that surge is? So this mimics a lot of things in nature and in science, the dampening of vibration in a bridge, flutter in an airplane wing. You throw a ball up and bounce, you'll see the same kind of graph. Anyone who's had you know, some basic science have seen these kinds of graphs before, and that's exactly what's happening here. This is a virus, you know, running its cycles. Okay, so it's a fourth surge. It's less than the others, and like I said, we're well into it. It is also much less impactful. For example, what we were told yesterday in Chicago, the deaths per day on the first surge was 50 a day, then it was 25 a day in the second surge. Third surge, it was 7 a day, and now it's 1 a day in Chicago. So flip to the next slide, which shows cases, or shows daily deaths. Now you see what happened there. So as you can see, what's happening right now, and that's you know, because of everything we've learned. It's because of vaccinations, it's because of a lot of things, and it's also because what we haven't had, so we've had numerous strains. We've had an alpha variant and I think a gamma variant. There's been all kinds of variants. This is not the first one, but we've had no strains which the CDC would call a strain of variant of high consequence. And that is when there's clear evidence that prevention measures or medical countermeasures do not work as well on curbing the virus compared to other variants. Variants of high consequence are not easily diagnosed, significantly reduce the effectiveness of vaccines, or have a high number of vaccine breakthrough cases and aren't easily treated. That's not what we're having here, and that's not what we're seeing, and that's not what typically happens with as you get variants. We're going to have variants of COVID for the rest of all of our lives, like we have variants of the flu. We are going to have more variants. Something we have to learn to live with. And remember, this was all done to flatten the curve and protect the healthcare system. Our hospitals are not at risk. For example, here locally, we have 2 Silver Cross and Payless Hospital. There's 1 person in the ICU bed in each with COVID. That's it. And even yesterday in our mayor's caucus briefing, the hospitals are not at risk. No one's saying that they are at risk. So the question is, if this was all done, these mitigation factors were all to keep the hospitals from being at risk, and the hospitals aren't at risk, why are we taking more mitigation measures? So I go back to that, we're doing this to protect the healthcare system. Flip to the next slide. Here in Orland Park, we're doing really well. As far as all residents, 61.3% have completed their vaccine completely, 71.2 have a minimum of 1 dose. I don't know why the suburban Cook County numbers are what they are, because that doesn't make any sense. But my guess is because in the past suburban Cook County has been lower for their completed vaccination, that they have a data glitch on their site. But one thing that you have to factor in, that's all residents. You can't even get a vaccine if you're under 12. That's a big portion of our residency. So when you strip that out, 86% of all of Orland Park have had at least 1 shot of adults, and 73.2% have completed the vaccination series. So we've done really, really well here with that. And I'm glad that we've cut the red tape to make the vaccine available, especially for those who are most vulnerable and those who are most severely at risk. I also understand that some people have concerns about taking the vaccine, because it is, after all, an emergency use vaccine. It hasn't been fully tested like all vaccines are, so I get that. My suggestion is that everybody talks to their doctor and makes the decision in conjunction with their doctors, the person who knows them best, and then make your own personal decisions. Okay? But here in Orland Park, we've seen this number, and that's been very, very helpful, and it mitigates, doesn't stop all transmission. It's only 95% effective, but it also clearly has been reducing the hospitalization rates or helping to do that. It's at least one factor. Flipping to the next slide. So Cook County cases by age. Now this is since the beginning, and you can see how high children are in that case thing, almost as high as 50 to 59-year-olds. Certainly higher than 60 to 60 than all of our elderly, and that's because there's so many children. There's double the amount of children in the under 20 as there are people in all the other age groups. Okay? If you look at hospitalizations by age since the beginning, you see the numbers that you see, and that is clearly that it's much more likely to be hospitalized if you're over 50, and those rates are down below. So you can see it just continues to climb as you get older and older. All right. Again, thankfully we authorized the vaccine because that's really helped those on that right-hand side of the second slide there, and the hospitalizations really helped drive that down and protect our elderly. So that's pretty important. Flip to the next slide. Now we've been hearing for over a month that this variant and everything is about kids, and kids are hospitalized at a higher rate, and kids are driving this, and kids and kids and kids. We've made the kids the boogeyman here, okay? And culminating by Wednesday, we have a mask mandate for schools. Nowhere else, not at Guaranteed Rate Field, not at Lollapalooza for sure, not at United Center. I was inside the United Center for concert. None of those places. Nowhere else, not here, nowhere else have we had one. Here's the truth. This is from the Cook County website. From 6/29 through August 5th, so 37 days, this is the amount of cases and the amount of hospitalizations by age. It doesn't look to me like that's being driven by kids who are under 20. I think it speaks for itself. Flip to the next slide. So over the last 37 days, if you look at it on a rate basis, so per 100,000 population, the case rate for children is half of the next highest group. It's 70 to 79 or 12 times higher. Hospitalization rates, 2 per 100,000 for kids, and going up the line, up to almost 80 for people who are over 80. So the facts are that this being driven by children is not a fact. These are facts from the Cook County Department of Public Health website. It's not about the kids. Why are we making mitigation factors about our kids? That just, to me, doesn't make any sense whatsoever. Flip to the next slide. So, since the beginning of this, we know that the mortality rate increases dramatically with age. This is Illinois cases by age, and you see that kids are the second highest group there in total cases by age in the state since the beginning. So it's always been kids get it a lot, but we don't see it's almost negligible how many deaths, and that's with COVID, not necessarily from it. It's one of the factors. So that's since the beginning. Okay. Go to the next page. Another important thing to remember is we target children, and we're making children. Remember, we made them the boogeymen way back when, that they're going to spread it and kill grandma and grandpa, so they have to stay locked up and they can't go to school. Okay? These are facts from the CDC. That's for children 17 and under. Okay? COVID in the last 18 months, 349, where COVID was a contributing factor. They had COVID basically when they died. It doesn't say they died from it, but contributing factor. 477 in the last full one-year flu season died from the flu. H1N1, it was between 890 and 1840. And we didn't do any of this for that. And that was 5 times more deadly for children. But here's the kicker. The last year of fully available data, the suicide is the second leading cause of death for 10 and 14-year-olds and 15 to 19-year-olds. In total, over 3,000 a year. Almost 10 times what COVID is. And we're taking these actions to kids. We locked them out of school for a year, and now we're forcing them to wear masks. Why are we doing this to our children? This makes no sense to me. So those are the facts. I just wanted to get that all out to the board, that we took the time to pull all this data down, and then I'll open up and listen to the board's comments.
Mr. Chairman?
Trustee Malani.
Seeing this is, in reading the resolution, obviously Governor Pritzker has once again used his office to lay the heavy hand of government upon the residents of Illinois, and in this case, this mandate requires masking regardless of vaccination, to require masks for all children in schools, and to possibly force state employees to be vaccinated, and it's just ludicrous. It's not based on facts, it's not based on science, not even common sense at this point. Long-term care facilities, they've been one of the least cared for segments of our healthcare network in Illinois, which was responsible for 41% of Illinois' COVID-related deaths. But now the governor is concerned with this. With this resolution, we're asking once again for our legislator to take a stand against this clear abuse of power and take a focus on the health, the safety, and the well-being of our residents. Thank you.
Any other comments?
Mr. Chairman,
Trustee Katsinas.
as a person who has a family member dealing with folks in mental health, this is a real deal to kids and is dramatically affecting their mental health. Just look at the figures on suicide. If that doesn't get a tear in anybody's eye, I don't know what does. We have to protect our children physically, understand that. What about mentally? Where's the measure on that? So I applaud what you're doing. I thank what you're doing. The board as a whole, somebody needs to stand up for the rights of these kids who are suffering in ways that sometimes cannot be measured before the outcome is too late. Thank you.
Mr. Mayor,
Trustee Reardon.
so if you read the language of what we're asking the legislature to do, all we're asking them to do is do their job. We're not taking an extreme position on vaccinations or masks in every single situation. We're asking them to share the data that they're using, to debate it, to have the different sections of the state of Illinois with their elected representatives go to Springfield, look at this data that the mayor just showed us, talk about it, show us if they have competing data. Let's talk about that. That's their job. That's what they're supposed to be doing. This is not supposed to come from the government. Either the very first day or the very first topic of any law school constitutional law class is about taking away the rights of the citizens in any aspect. Doesn't matter what it is. If you're taking away the rights of a citizen, which can be done, it needs to be as narrowly tailored as possible. There's 100 constitutional law cases on this. You're supposed to use a scalpel, not an axe. Okay, that's a language that's used by Supreme Court justices all along. What this does, what the governor continues to do, is one size fits all. You've heard that talked about before. Our school board, District 135, was working very hard. They were looking at data and coming up with a plan for this school year to try to see what would be best for us based on the data that's localized here in Orland Park. And this completely takes that away. So again, people are going to take what they want out of this resolution, but really if you read it, all we're asking them to do is do their job and have it be out in the open about what's going on. So I fully support it.
Trustee Healy.
Mr. Mayor, thank you. I wholeheartedly endorse this measure tonight. The governor is currently doing an overreach of his power. He's been doing it for ever since he got in there. I just can't comprehend why the Illinois legislature allows our system of government to crumble. Their job is to oversee, is to keep a check on the governor, and they don't even meet, they don't even discuss, there is no check on the governor. This inactivity by the legislature erodes the public trust and confidence in our elected leaders, and also the belief that the government serves the people. It seems like that the people are serving the government. The old saying is that you're either part of the problem or part of the solution. The state legislatures who represent my home in Orland Park are part of the problem. Their lack of addressing issues, lack of doing their jobs that they volunteered for, and lack of being responsive to the voters is unacceptable. Mr. Mayor, I'm proud of the fact that I sit on a board where you and my fellow trustees do not kick the can down the road. These issues should be addressed immediately. I can only pray that our citizens will recognize the changing of our society from a successful capitalistic society, encouraging success and motivating citizens to participate in success. We're moving to a socialist tyranny. I fear our citizens are victims of their own complacency. There must be a reckoning, and I just ask, when will the people of Orland Park join in our voice against the despotism of Illinois?
Mr. Chairman.
Trustee Compass?
500 days. For over 500 days, we've been under emergency orders that were designed to expire the authority in 30 days. Emergency order authority exists for moments when the representative government does not have time to respond to the event. The Illinois General Assembly has had enough time to respond. They had time to pass and amend a disastrous bill that further erodes law enforcement efficacy. They had time to raise our state gas taxes. They took the time to redraw the electoral district boundaries despite not having the proper census data available. The 30 days clause is a limiting principle to keep the executive branch from abusing power. If the governor cannot simply keep extending the period indefinitely on his own whim. The limiting principle then is useless. If our General Assembly agrees with the governor's direction, they must meet to debate and codify it properly. In essence, they have to do their job as representatives of the people of Illinois. Unfortunately, it's not just an abuse of time, but also an abuse of scope at play here as well. Not even a full month ago, on July 17th, Governor Pritzker had this to say about the mask mandates. Quote, "Families should be involved in making decisions for their own families, and school districts and school boards will make decisions for the schools within their districts." Unquote. But it wasn't just the governor that thought his authority was limited with regards to schools, both public and private. After watching private schools successfully conduct full-day in-person learning this past year, the Illinois House passed House Bill 2789 in an attempt to transfer authority from school boards and private institutions to the IDPH. That bill failed to even come to a vote in the Senate as opposition in the constituency mounted. But the mere existence of the bill demonstrates that the majority party at the General Assembly also questions the scope of the governor's authority under these circumstances. The governor is now attempting by decree that which the Senate could not even vote on, let alone pass. The governor is also contradicting his very own principles from July 17th. Although I suppose I should not be surprised given his and his family's failure to follow his own rules over this past year and a half. Now, because he disagrees with duly elected and empowered school boards in the state, he's unilaterally overruling them. This further erodes the checks and balances set by the state constitution. Our government is formed by we, the people, not I, the governor. We entrust our leaders with authority bound by the limits of law. 500 days. At what point will the emergency orders that exist only to account for timeliness end? With the inaction we have seen from our legislature, that answer appears to be when the governor says so. Our governor doesn't engage and doesn't share his data with local leaders while he decides what's best for everyone. Even if one agrees with his conclusions, his actions and communication are awfully inadequate to his position and the principles of the republic. This is not how you build trust in government. So much for representation and the voice of the people, and so much for rule of law. It's beyond time for our representative government to do their job. Thank you, Chairman.
Any other comments?
Mr. Mayor?
Trustee
I'd like
Radzewski.
to also chime in. Obviously, I too believe in this resolution and would like the governor to share that data. I don't think that he should be abusing that power. And to the point about the children and the suicide rate being so high, I mean, it's sad, it's astronomical, but it's also all people, you know, I mean, mental health issues are on the rise and they have risen, and you know, it's impacting people of all ages. So hopefully, you know, we can do something about that.
Any other comments? So my comments, yet again, our governor has attempted to rule by fiat. Same as many of the other things that he's done in the last 18 months. Looking at history, nobody should be surprised. A reminder that he unilaterally gave the following orders by fiat. Stay at home and do not go outside, which we know is wrong. He closed parks. We know that's wrong. He closed golf courses. Wrong. Closed small mom and pop businesses while calling large corporate conglomerates, recreational pot shops, and liquor stores essential. Wrong. And now he says that was because the federal government told him to do it, which is not true. He said that a family of 6 could drive to a boat ramp, but only 2 people could get on the boat. He said that originally when we opened back up, that 10 people could go into a restaurant and meet. No mask, no nothing. They could go meet in a group, as long as they didn't eat or drink. As soon as they were going to eat or drink, they had to go outside, and they had to split into groups of 6. He closed schools because they weren't considered essential. Right? Schools, not essential. Just let that sink in for a second. When I opposed these actions, the actions that weren't supported by data, I was labeled many things. And people sent me emails hoping my family would die from COVID. Looking back over the last year, it shows that I was right and the board was right. I was right because I don't make uninformed decisions. It was not an accident. I used data, facts, and I drew logical, common sense conclusions. I also didn't make any giant leaps or whimsical choices. Frankly, I made the easy ones, the slam dunks. All it took was to take the time to understand the data, a little bit of logic and common sense, and basic skills that are required in risk management in any job where risk is something that you manage. What is astonishing is that these actions and many others were taken without passing any laws. This is America. We operate by the rule of law. Apparently, our state legislature needs to be reminded that we're a nation of laws. If you want measures like this enacted, then stop hiding behind emergency orders and go through the legislative process, present the facts, debate, and vote. It's what our citizens deserve. It's what we should demand. Get back to work, do your job, and stop a runaway executive that is acting like a monarch rather than an elected official. We were labeled as wanting to kill children a year ago because we wanted them to be in school. They were wrong. We found that kids could be in school because so many schools did it. The same people who attacked us now say, kids must be in school. You don't care about kids' education because you won't let us mask them. Those are the same people that were telling us we were trying to kill them by trying to get them in school, because we were wrong then too. So now by fiat, the governor is forcing mask wearing in schools. He said, and I quote, "Far too few school districts have chosen to follow the federal CDC prescriptions for keeping students and staff safe. I had hoped that a statewide mask requirement wouldn't be necessary, but it is." Dr. Ezike added, "There is an abundance of epidemiological evidence that supports community masking to reduce the spread of the virus." I just showed you the data. That's just factually not true. That's lying to the public. It's not true. If they have the data, then show us. Dr. Ezike, the governor, on your advice, is only masking children and only at school. That data showed it wasn't kids that was the issue. Why only at school? Why the continued attacks on our children? You stopped the school year short, causing students to lose 2 months of learning and a season of spring sports. You led the effort to conduct learning experiments of independent study, Zoom classes, and what we now call hybrid learning. Some students thrived in that environment, but most did not. Many were left behind. For an entire year, you took away many of our children's activities. We have done all of this to our children for a disease with a case mortality rate for children that is nearly 0. The entire narrative for the last month has been the Delta variant and how horribly children are affected in driving the case rates up, which I just showed you is not true. There is 0 evidence to support masking our children in school, particularly when there are no other mandates for any other age group, when every other age group has a higher case rate, sometimes 12 times higher, and hospitalization rates up to 40 times higher. We are forcing children to wear masks for the safety of unvaccinated adults and the peace of mind for other adults who fear our children because they have been told time and again that they should fear our children because of COVID. We've made our children the bad guys for a disease that doesn't impact them. That's wrong. I don't think our children should bear the brunt of a disease that has no impact on them to make adults feel comfortable. Many children have stuffed animals to give them comfort. We need to stop using our children as comfort toys for our adults. They are human beings and have rights, and their parents should be allowed to make the decisions that are best for their own children. Adults should be protecting them, not the other way around, and should be doing everything possible to let them have normal lives. Thank you very much. With that, I will call the vote on this resolution, but I will let everyone know what we're asking them to do first. So we are calling for the Illinois General Assembly to end its abdication of responsibility and reconvene to address the health, safety, and welfare of Illinois residents in light of COVID-19 by exercising its valid authority to legislate. We are asking them to re-examine the governor's mandate to require universal masking regardless of vaccination status and allow parents, with advice of their pediatricians, to make masking and vaccination choices for their children. We also call for them to re-examine the governor's executive orders and provide for fact-based mitigation measures with reasonable guidelines designed to promote the health and wellness of Illinois residents, including the residents of Orland Park. We also call for the General Assembly to afford adequate due process for any municipality, corporation, or individual resident of the state of Illinois or any business in the state of Illinois to appeal restrictions or orders based on their individual circumstances. We also call on the General Assembly to significantly enhance efforts to protect the vulnerable populations in long-term care facilities, as Trustee Malani mentioned, and managed care facilities like LaSalle Veterans Home. Lastly, we call for the General Assembly to require the governor and executive branch to increase transparency by providing to the general public the data, models, and assumptions that have been used as part of this pandemic response decision-making, because the stuff that we see does not support the decisions that are being made. With that, I will ask you to call the roll, or call the vote.
Trustee Malani?
Aye.
Trustee Compass?
Aye.
Trustee Healy?
Aye.
Trustee Katsinas?
Aye.
Trustee Reardon?
Aye.
Trustee Radiszewski?
Aye.
Mayor Peacock?
Aye. The resolution passes 7-0.
Non-scheduled citizens and visitors.
We have two here. We have Shannon Olson. Do you still want to speak? Okay. You have 3 minutes.
Thank you, Mr. Mayor and the Village Board, for doing your sworn duty to uphold the Constitution. In the Illinois Constitution, the governor is granted the ability to declare an emergency for up to 30 days. He did this in the middle of March in 2020. It is now August 6, 2021, yet he continues to renew this unlawful order. That is approximately 17 months in a state of emergency, 16 months longer than constitutionally allowed. The governor is not interested in following the Constitution. This is where the legislature is supposed to step in, yet they have done nothing to check this tyrannical power. They have sworn an oath to uphold the Constitution, yet they do nothing. Legislators, do your job. It was reported in a Patch article yesterday that we currently have 4% of Illinois hospital beds occupied by COVID patients, only 4%. Also, 72.2% of Orland Park residents have had at least one dose of a COVID vaccine, and 61.3% are fully vaccinated. Where is the emergency? Less than 30 days ago, the governor stated that the local school districts were to decide the rules for their schools. The school board stepped up and carefully made the decisions with input from the parents of the students they serve. On Wednesday, August 4, the governor changed his mind, stating that he didn't like the decisions that the school districts made. So he mandated masks for everyone entering a school building, both public and private. Again, this is not legal. He does not have the authority to make these blanket mandates. Undoubtedly, some people are happy about this decision. But that does not mean that this is legal or right. Parents, how would you feel if this was turned around and you were told that your kids could not wear a mask in school? If they punished your child for wearing a mask? My child is 14. It'll be her first time in high school. She is terrified that she will not be able to learn from these teachers with masks on. She is terrified she will not be able to make friends in a school because they all have to wear masks. What about her? What about her mental health? You saw the statistics. What about that? COVID is here to stay. It has been over 18 months since the first identified COVID case in Illinois. This is no longer an emergency. I will end with this quote from Benjamin Franklin. He who would trade liberty for some temporary security deserves neither liberty nor security. I am not willing to do that. Are you? Legislators, do your job. Thank you.
Thank you for your comments. Barb Catchy.
Well, I actually came here for a totally different issue than the mask issue. But now that everyone has really vehemently discussed this, I actually work in a public school. I actually work in a preschool to grade 5 public school right down the road. We wore masks all year. I actually wore 2 masks all year. I didn't miss a day of school. And actually, we had a hugely successful school year. The kids were happy. No one ever complained, not a single child. I teach in the preschool ages 3 to 5. No one complained. All the other kids came in as happy as could be every single day. So I was actually relieved to hear that I had to wear a mask this school year, because I've got coworkers that are recovering from breast cancer. I've got coworkers that have autoimmune disorders. I've got coworkers that are going home to their husbands who are recovering from cancer treatment, that are in cancer treatment. So I'm just going to say from my own experience, working at District 118 every single day, I didn't miss a day of school. The children never complained, not once. The parents, yeah, they were belly aching, but not many. So actually, we had a very successful, awesome school year without missing a single day. So, like I said, I did not come here originally to talk about masking. But now that I'm going to be starting school in a couple weeks and everyone was discussing it, I just felt I had to give my input, because I'm actually on the front line. I'm working with these children every single day, grades preschool through grade 5. Do any of you work with children?
Yes.
Up here on the board, do any of you work with children? Do any of you work with children? Yes or no? Or?
The board doesn't engage with
Oh, okay,
speakers.
Sorry, because, you know, when you're working with kids, they are like sneezing in your face.
30
and
seconds.
Coughing at you this close. So actually, the mask worked out awesome. And, you know, until science evolves, and science is evolving every day. So right now, it's working. Now, maybe next year, we won't need them. Great, but it wasn't a big deal, just to let you all know. Everything was, you know, it was a good school year. So kids played on the playground, kids did art. We had music class, you name it. So, and same thing with my coworkers who sent their kids to parochial school. They had masks. Did kids get sick? Absolutely.
Time is up.
Okay, thanks.
Thank you very much for your comments. Does anyone on the board have anything to add? The board comments? The only thing that I have to add is, so first off, I'd like to thank you for your comments, and also I'd like to thank you for the fact that you, in fact, hold that position and actually are wearing a mask in here, because the people who are making these decisions that are mandates, which is a fundamentally different thing than people having a choice, are not wearing masks when they go to places. They're in the United Center. They're at Lollapalooza. They're at all of these places, and they're making these decisions and forcing others. So I think what this board is asking for, what we've all asked for all along, is to let parents and their pediatricians make the choices. It's not a mandate. Government mandates is, to Trustee Reardon's point, is taking away rights. And when you do that, you have to do that very narrowly and for a very short period of time. And that's a government's role. When the government goes beyond that, it's a problem. If the state legislature believes that this should be in place, they should get together in session, debate it, bring data and facts, because there will be people on both sides of the issue, and debate it and make a choice and make a law. If they make a law, it's a completely different discussion we're having here today. But they have not. One person should not make those edicts. They should not make those mandates. Everyone has a choice. With that, I'll take a motion to adjourn.
So moved.
Second.
Call the roll.
Trustee Compass?
Aye.
Trustee Malani?
Aye.
Trustee Healy?
Aye.
Trustee Katsinas?
Aye.
Trustee Reardon?
Aye.
Trustee Radiszewski?
Aye.
Mayor Pico?
Aye. Adjourn.